Hello, thank you for attending our presentation on healthcare data center design. I'm Zachary Craig.
I'm Tyler McGee.
And I'm Brumage. So, to start off, why should you care about healthcare data center design? Is it really important? According to the organizations themselves, IT is considered a critical functionality for a number of reasons. With the digitization of patient data, hospitals need to be sure that staff can access what they need when they need it. Laws like HIPAA add a compliance angle to the issue. Healthcare providers should only have access to the minimum necessary information to treat their patients, and other doctors shouldn't be able to see patient information at all if they're not directly involved in the treatment plan. There's also the goodwill aspect of data security. A hospital with an insecure data center is not likely to have many patients, especially if that lack of security leads to data leaks or periods where the hospital cannot operate at full functionality.
All right, so what's the best way to set up your healthcare organization's data center to ensure maximum security and the least likelihood of service interruption? We put together a few suggestions. First, we're going to run through a data center design that would minimize risk while maximizing instantaneous access to data. Then we'll go over the best way to maintain a data center so that minor risks today don't blossom into major risks down the road. Finally, we'll give a couple of real-world examples of hospitals that have had disaster strike and how they're able to respond.
Redundancy, a hospital's best friend. The first key to a good data center, backup. We propose on having 2 data centers within 45 miles of each other. This ensures a catastrophic localized event won't necessarily bring down the hospital. To ensure that IT as a service department can deliver a consistent and reliable experience, it is important to consider the options available to keep the data centers running at all times. The first design consideration is to build with the idea that there will be 2 data centers within our network, built around the idea of running an active-active setup. The data centers themselves will need to be fully redundant in terms of physical layout and equipment. Dual power feeds from separate service lines that have no cross points ensure that a wrecked power pole won't show power to the data center is ideal. Backup power generation in the form of dual UPS banks that can float power to the entire data center for a period of 20 minutes ties to dual diesel generators, each of which can run the data center independently. Maintaining a diesel tank on site of sufficient quantity is also needed. 2 external network connections from 2 separate providers allows for failure and failover of ISP when needed. All equipment in the data center should operate under a 2N design with double the amount needed to run. Each data center set up under these rules, we can tie them together with an application load balancer such as the F5 Big IP or Citrix NetScaler to allow for fully active-active operations. The final portion of an optimal design is the incorporation of a cloud-based form site. Leveraging Amazon's AWS and technologies like Microsoft Azure, allows us to replicate most functionality to an off-site data center with all the redundancy that large data centers can provide.
All the redundancy and backup tools we add are no good if they are not maintained properly. All backups need to be maintained as if they were actively in use. This means patches and updates and constant validation checks. The backup sites also need maintained, and all backup power and data connections need to be in constant check. Change control should also be put in place so nothing is changed without everyone knowing about it. User access also needs to be controlled to ensure old accounts and ex-employee accounts are deleted and active accounts still have least privilege. For hazards, there are multiple disasters, both man-made and natural, that can destroy a network. Where there is a major one, if a major storm comes through, it can do a lot of damage to a data center. Even if the building isn't touched, it can still knock out the power, and if there is no generator, or if it's not functioning, all power can be lost. Malware, hardware failures, and fires could also hurt the network and information security. We protect against this by having failover clusters, RAID arrays, backup power, and cold, warm, and hot sites.
To illustrate our earlier points, we'd like to run through a couple of real-world examples of a disaster striking hospitals. In 2011, an EF5 tornado struck St. John's Regional Medical Center. Due to the hospital and Joplin's disaster preparedness training, providers were able to immediately respond and continue to administer care, despite having to evacuate the hospital. For example, when the tornado was spotted heading towards the hospital, patients were quickly moved to safer spots. After the tornado came through, destroying backup generators and covering the ground in 2 inches of water, employees successfully evacuated the hospital and set up temporary treatment facilities. Despite roads being impassable for emergency vehicles, St. John's was able to render emergency services to patients that were able to travel to the hospital grounds. Joplin health officials had also worked previously to implement a 3-day care plan for all dialysis patients, so that when the tornado hit, they had enough time to find a working hospital to receive treatment. According to the CDC, the Missouri Department of Health and Senior Services, or DHSS, deployed the state's 24-bed ER mobile medical unit that treated 157 patients and even conducted door-to-door checks on residents, among other services. This disaster response is touted as one of the best by a healthcare organization, showing that a thorough readiness plan truly saves lives.
Our second real-life example of the importance of data center consideration is the WannaCry ransomware attack from 2017. For a story on why having a robust data center maintenance plan is important, one must look no further than the May 2017 WannaCry ransomware attack, in which hackers demanded a ransom to unlock infected computers. Hackers used Eternal Blue, an NSA hacking tool that had been publicly released by hackers. Alerts were issued in March and April warning organizations to patch their software to prevent such an attack from occurring. In addition, there have been warnings since 2014 from the Department of Health in the UK not to use outdated software, like Windows XP. According to our sources, Windows XP remained a popular operating system on NHS computers. In total, 595 English GP practices were affected, and 81 of the 236 NHS trusts had some disruption. While none paid the ransom, hospital operations were disrupted, and many organizations had to revert to pen and paper temporarily. This is an extremely avoidable event and illustrates the necessity of having a risk management plan, as well as regular IT maintenance.
That brings us to the end of our presentation. As you can see, we have our reference source available for your, if you want to go back and look at what our research was. If you have any questions, please feel free to send us an email and we'd be happy to respond to those. Thank you for listening and watching our presentation.
Control all that.